Welcome viewers, welcome to Medico Virally. Today we are going to discuss about the breast. Few pathological conditions will be introduced and later on we will be discussing in the subsequent videos in detail. So breast is a hormone sensitive tissue. The main hormones which is sensitive are the estrogen and the progesterone. So the estrogen helps in the alveolar and the ductal growth. So it helps both in the growth of alveolar and the ductal growth. Whereas the progesterone helps only to differentiate the alveolar. So the alveolar differentiation is done by progesterone. And the other main topic is lactation. So, during the lactational period, there are two important hormones, that is oxytocin and prolactin. The oxytocin will help you in milk ejection. The prolactin will help in milk production. So how to remember it in easy way? That is, the oxytocin will help to let out. So remember it, milk lets out. So O for oxytocin and O for out. So the milk gets out. And next coming to prolactin. Prolactin, P for prolactin and P for production. So milk is produced. So it produces. In this way we can remember the main functions of these hormones. So when does the breast tissue grow? So the breast tissue mainly increases in size in two conditions, that is at puberty and the other at lactation. So during these two stages the breast tissue increases in the size. And when does the breast tissue undergo atrophy? The breast tissue undergoes atrophy after menopause, that is post-menopause the breast tissue undergoes atrophy, so decrease in the size. So this is the general information we have to remember. And coming to the structure of the breast, so I will be just drawing a small diagram to explain you the basic anatomical structure of the breast tissue. So the one which I have drawn is the duct, and here at the duct we find lobules in this way. So at the end we will be find another terminal duct, that is, as I am drawing in the image, just follow the image. So this unit, this entire unit, we call it as TDLC. TDLC is nothing but terminal duct lobular unit. So this whole is known as TDLC, terminal duct lobular unit. And the inside this we find the hormones prolactin is sensitive at this area, and hence the milk production is occurred at this place. So this is, and the other one, this part is known as, this each individual part is known as lobule, and this is duct. So once again, this is the duct, and this yellow part which we are highlighting in the image is the duct, and the green part which we are highlighting is the lobule. Hope the image is clear. And coming to the components of the breast tissue. So the components of the breast tissue are mainly two components. The first one is the supportive tissue that we call it as stroma, and the second one is epithelium. About the stroma, just remember it is supportive in function. And coming to the epithelium, we have to draw a small diagram regarding the epithelium. Suppose this is a duct. In the outer part, we find a myoepithelial cells, and in the inner part, we find another epithelial cells which are a specialized columnar cells. These are known as luminal epithelium. So this part is luminal cells and this part is myoepithelial cells. So how to remember which is inside and which is outside? So when you just look into the word, the myo has an O which is indicating that it is located outside. So the outer layer, and the luminal has in, so which tells you that is inner layer. So the inner layer is the luminal cells and the outer layer is the myoepithelial cells. And luminal cells need vitamin A for differentiation. So vitamin A is required for differentiation of the cells. For example, if a female has deficiency of vitamin A, then there may be a squamous metaplasia, so the change of epithelium. This may lead to a cancerous conditions also. And when we call the epithelial hyperplasia, so when we call this condition as epithelial hyperplasia is when there are more than two layers of the cells, then that condition is known as epithelial hyperplasia. So these are the main components in the breast tissue. The first one is the stroma and the second one is epithelium. So the outer part is myoepithelial cells and the inner part we have the luminal cells. The luminal cells require vitamin A for their differentiation, and luminal cells are made up of specialized columnar cells, and the outer myoepithelial cells are located. So when a female has a deficiency in vitamin A, and then the condition may transform into a squamous metaplasia. Now we are going to discuss about the quadrants of the breast. So as shown on the screen, there are mainly four quadrants of the breast: the outer upper quadrant, the outer inner quadrant, and the lower outer quadrant, and the lower inner quadrant. So these are the four quadrants. We have each quadrant has its own importance, and we must remember mostly two quadrants for MCQ purpose. So the first one is the outer upper quadrant. The most dense tissue is present in this area. Most dense tissue is present in this area. Another point which we have to remember regarding outer upper quadrant is most common site of malignancy. Most common site of malignancy is outer upper quadrant, and the least common site of malignancy is lower inner quadrant. Coming to the drainage, lymphatic drainages are the outer upper quadrant drains into the axillary lymph nodes, and this area is axillary lymph nodes, and the inner quadrants of the breast tissue, they drain into internal mammary lymph nodes. So this is the lymphatic drainage of the breast tissue. And main points are: the most common site of the malignancy is outer upper quadrant, and the least common site of malignancy is lower inner quadrant. And now we will be discussing a pathological condition named nipple discharge. Nipple discharge is of mainly four kinds. The first one is bloody discharge, and the second is greenish discharge. Third is purulent, and the fourth one is galactorrhea. These are the main four conditions which we have to remember under the section of nipple discharge. So, bloody discharge is mainly due to two reasons. That is, it is due to intraductal papilloma and ductal carcinoma. So, intraductal papilloma is an outgrowth which is seen in the duct. In the duct, we find an outgrowth which may obstruct the flow of the duct. So, this condition is known as intraductal papilloma. So, the most common cause of the bloody nipple discharge is intraductal papilloma. And regarding the greenish discharge, we have to remember only the name of the condition in which the greenish discharge is present, that is mammary ductal ectasia. Ectasia is an abnormal bulging or dilation of the gland or tube. We will discuss in detail in the later videos. Coming to the purulent discharge. Purulent discharge is seen in acute mastitis. We discuss about the condition in the coming section. Galactorrhea. Regarding the galactorrhea, we have to remember few important points. What is galactorrhea? Galactorrhea is an abnormal ejection of milk outside the period of lactation. So, the milk ejection other than the period of the lactation is known as galactorrhea. So, when the galactorrhea can be seen, it is mostly seen in three conditions. The first one is mechanical stimulation. When mechanically the breast tissue is stimulated, then the abnormal ejection of the milk is one of the reasons. And the second cause may be drugs, and third one due to endocrine reasons, endocrine dysfunctions. So what is mechanical stimulation? This is maybe during the breastfeeding or during the sexual intercourse. When the breast tissue is mechanically stimulated, then there may be a chance of abnormal ejection of the milk in few females. And this is the most common physiological disorder. Physiological disorder. And drugs, mainly we have to remember three drugs, that is oral contraceptive pills, and the other is the H2 antihistaminic drugs, antihistaminics, and the third is antipsychotics. Coming to the endocrine one, prolactinoma, a condition where there is an excess amount of prolactin present which leads to overproduction of the milk, may also lead to galactorrhea. This is the most common pathological cause. Physiological cause was mechanical stimulation, and the pathological cause or disorder is prolactinoma, and the other endocrine cause is hypothyroidism. So these are the main points which we have to remember regarding the nipple discharge, mainly of four kinds: bloody, greenish, purulent and galacturia. And now in this section we are going to learn about the inflammatory conditions of the breast tissue. Inflammatory conditions of breast tissue. In this section, it is divided into mainly 5 parts. That is, we have acute mastitis, and other is Zuska's disease, and the third one is Mammary duct ectasia. The fourth one is fat necrosis, and the fifth one is lymphocytic mastopathy. We discuss detail regarding each inflammatory condition. The first one, which is most important, is acute mastitis. Acute mastitis is a condition where there is an inflammation of the muscle, breast tissue, inflammation of the breast tissue. This is most commonly present in young females. In the nasopharynx of the babies, there is a bacteria named Staphylococcus aureus. This bacteria is a purulent organism causing pus. So, the condition is associated with a purulent nipple discharge. So, by the pathogenesis, we can understand the clinical features would be, as it is a bacteria, there would be an increase in the temperature leading to fever, and as it is an inflammatory condition, we find pain, swelling, and the redness and purulent discharge. So these are the main clinical features regarding the acute mastitis. How would you diagnose this situation? The diagnosis of the situation mainly stands with ultrasound. And how would you treat this situation? The female comes to you with a complaint of increase in the temperature, pain in the breast, and swelling. So first of all, you have to decrease the pain. So for this pain and swelling, for this you prescribe non-steroidal anti-inflammatory drugs, NSAIDs, and for the bacteria, you will be prescribing penicillin group of drugs. Mainly, you will be prescribing three groups which would be fluoxetine, dicloxacillin, and other is amoxicillin. After this, you would be trying to aspirate the pus. Aspiration under guidance of the ultrasound. If this is not possible, and then you will go for an incision and drainage. This is the main treatment. Once again, a quick wrap up about the acute mastitis. Most commonly we find in young females, in the breastfeeding young females. It is mainly caused due to the Staphylococcus aureus, which is a purulent organism, and the diagnosis stands with ultrasonography. treatment NSAIDs, penicillin route, aspiration, and incision and drainage. And the next condition we would be learning is about Zuska's disease. Zuska's disease is also known as periductal mastitis. Periductal mastitis. So the inflammation is present around, suppose this is a duct, and the inflammation or the pathological problem lies around the duct. So peri means around. And now this disease is associated mostly in smoking females. Zuska's is associated with the smoking females. In the smokers, there is an observation that vitamin A is less. So there will be a deficiency of vitamin A. This leads to squamous metaplasia, as we heard about it in the starting of the video. Squamous metaplasia. This leads to increase of the epithelial cells, causing obstruction of the duct. And due to this obstruction, there will be an abnormal dilation of the duct. This is the main pathogenesis regarding Zuska's disease. So what are the clinical features regarding the disease? The clinical features associated with Zuska's disease are subareolar mass. There is a mass present under the areola, and as it is also an inflammatory condition, when we see the other name, it is periductal mastitis. So pain and swelling, redness. Nipple retraction is also seen in this condition. Nipple retraction. And due to the overgrowth of the luminal cells or epithelium, there may be fistula formation. These are the clinical features associated with Zuska's disease. So it may be also associated with malignancy. And the next we are going to learn about an important condition named mammary duct ectasia. So here ectasia is an abnormal dilation, and the duct gives you an abnormal dilation in the duct. As I am drawing here, you can find there is an abnormal dilation which leads to collection of the secretions inside. So when all the secretions are collected inside, there is an abnormal overgrowth of the tissue inside, and this secretion would be thrown out, or this would be expelled or leaked inside the tissue. So when the secretions are being pushed out, then this is associated with a discharge, and when the secretions are leaked into the tissue inside, then it is associated with inflammatory conditions. That is mammary glands, M. So it is mostly seen in multiparous females, elderly females. So due to this dilation, I already explained, there is the accumulation of the secretions leading to the nipple discharge, or the leak out of the secretions leading to the rupture or nipple discharge. And this is not associated, this condition is not associated with smoking, and it is not associated with malignancy. On microscopical examination, you find this as chronic granulomatous inflammation. Here, this disease is also known as plasma cell mastitis. Why this is called as plasma cell mastitis? Here on microscopical examination, we find chronic granulomatous inflammation. So the lymphocytes, the macrophages, and the plasma cells are present on the biopsy slide. This is the thing you have to remember. And coming to the clinical features of the disease, as we already remember, that is a nipple discharge. The color of the discharge is greenish brown. This is the main points regarding the mammary duct ectasia. Remember, the M must get the multiparous female elderly patients, and here you have to remember this diagram so that the secretions and the rupture, due to the rupture you find the inflammatory conditions and infiltration of the lymphocytes, macrophages and the plasma cells, and this is not associated with smoking or malignancy. Main clinical feature is greenish brown discharge. This is all you have to remember about the mammary duct ectasia. And coming to the fourth inflammatory condition, that is fat necrosis. Fat necrosis is mainly associated with trauma and surgery. So, during a surgical condition or a traumatic condition, the breast tissue may undergo fat necrosis, and due to the enzyme lipase, the fat is divided into free fatty acids and the extracellular calcium present, and these both are united to form dystrophic calcification. When the free fatty acids unite with calcium, it may lead to dystrophic calcification, which we observe on X-ray film. It is also a malignant condition. Microscopical examination reveal you two main points. That is, we find a foreign body giant cells and lipid laden macrophages. On microscopical examination, we find these two important findings for fat necrosis associated with the breast tissue. This is all you have to remember about the fat necrosis. The main points are here you have to remember is the lipid laden macrophages associated and the FB foreign body giant cells which you find, and dystrophic calcification. And the last condition we will be discussing here is lymphocytic mastopathy. The lymphocytic mastopathy is an autoimmune condition. So, this disease is mostly associated in females who have type 1 diabetes or autoimmune thyroid disease. Autoimmune thyroid disease. The main clinical feature associated with the disease is one or more than one hard mass will be present in the breast tissue. This is the main clinical feature. On biopsy slide, we observe mainly 3 points, that is, duct and lobular atrophy. The atrophy of both the ducts and lobules can be appreciated on the biopsy slide, and the collagen would be dense, and there is an infiltration with lymphocytes. So these are the main points you have to remember about the lymphocytic mastopathy. A quick wrap up regarding all the important points which we have discussed in this video are: today we have learned mainly about the breast, which is hormone sensitive, and we have mainly 2 points: estrogen and progesterone. It is the estrogen is for both the alveolar and the ductal growth, and progesterone is only for the differentiation of the alveolus. During the period of the lactation, oxytocin is helpful for the letting out of the milk, that is milk ejection, and the prolactin produces the milk, that is milk production. And there will be an increase in size during the puberty and the lactation, and atrophy after the menopause. And this is the terminal duct lobular unit, and this is most common function. It is the functional unit of the breast tissue. The components of the breast tissue are stroma and epithelium. And in the epithelium, we have two main layers. The outer one is the myoepithelial cells, and the inner one is the luminal cells. Luminal cells are made up of a specialized columnar epithelium cells. Luminal cells need vitamin A for differentiation. When a female has decreased or deficiency of the vitamin A, then it may undergo squamous metaplasia. When there is more than 2 layers of the cells, it is known as epithelial hyperplasia. And regarding the quadrants of the breast tissue, the outer upper quadrant is the most dense tissue, and it is most common site of the malignancy. And the lower inner quadrant is the least common site of the malignancy. Regarding the drainage, lymphatic drainage, the inner quadrants are draining into the internal mammary lymph nodes, and the outer quadrants will be draining into the axillary lymph nodes. So this is the main important point. And coming to the nipple discharges, we have mainly 4 types: bloody, greenish, purulent, and galactoria. And inflammatory conditions of the breast tissue are mainly 5 conditions. Out of this, acute mastitis is most important, and it is seen in young females. Main organism Staphylococcal aureus, and it has a purulent discharge. Zuska's disease, which is associated with the smoking females and who have the deficiency of the vitamin A, undergoing to the squamous metaplasia, leading to the obstruction and dilation of the duct. This is associated with malignancy. And mammary duct ectasia, the M must remember your multiparous female elderlies, and this is not associated with smoking or malignancy. So the secretions are collected in the abnormally dilated part, which may lead to the excretion of the secretions and rupture due to the heavy dilation. We find a lymphocytic, macrophagic, plasma cell infiltration. Here the main nipple discharge is greenish brown in color. And fat necrosis, mainly associated with trauma and surgery. And the free fatty acids and calcium unite to form dystrophic calcification. And we appreciate that most commonly in the X-rays. Mainly in microscopical examination, we find 2 types of cells: foreign body giant cells and the lipid-laden macrophages. And the last condition is the lymphocytic mastopathy, which is autoimmune condition where it is associated with type 1 diabetic females and autoimmune thyroid females. Then clinical feature, it has more than one hard mass in the breast tissue. On the biopsy slide, we find these 3 characteristic features will be seen. This is all about the breast and its disorders. Just it is an introductory video, and in the next videos we will be discussing about the benign epithelial lesions and the stromal lesions. Thank you for watching. Kindly subscribe.